Happy Friday, everybody. Welcome to the internet's favorite show about plastic surgery, health, and beauty. This is Nip Talk. Segments for today. First off, grandma makeovers. How old is too old to have plastic surgery? And then MonkeyPox. Is this the next big pandemic? And then finally, a nightmare facelift leaves a patient blind. We're going to talk all about it, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Thanks to all those listening on audio podcasts as well. I'm your host, plastic surgeon Dr. Bruce Hermann. With me is the wonderful Sarah.
Hi.
Hi, wonderful Sarah. In the box, we got Travis. What's up, buddy?
Hey, how's it going?
Doing good. Everybody have a good week. Anything new and exciting?
I just started school again.
Sarah started school again. Getting your master's, right?
Yeah.
Getting your knowledge on?
Yeah.
How's it going? First week?
Yeah. I just forgot how much I really don't like writing. Or just how, I guess, what's the word for it? I just haven't practiced that.
It just feels tedious.
Yeah. It just feels like my brain's just like,
yeah.
I don't want to do this. So then I just sit there like staring at the screen waiting.
I remember when my wife got her master's, she did it kind of the same way that you're doing yours, like online. I remember her saying the same kind of stuff. It's like, man, now it's like I'm back to school again.
Your brain doesn't like process information the same. It's like, I just want to know what I need to know. I don't want to read 20 million pages to figure out like one, I don't know. I
think it is really cool though that you can get these advanced degrees now while you're, working. I mean, you obviously have, your full-time job, and then same thing with my wife. She was working full-time and, got her master's, like, doing classes at night or on the weekends. And I think that's great. I went back and took some classes just for fun. I was taking English classes because I do like to write, and so I romanced the idea of trying to, get like a degree in English, but I just get too busy. And
yeah, you don't need a degree to write.
I know. I was just doing it really just for the practice, and I was doing like composition classes, and yeah, I enjoyed it. But Travis, anything with you, buddy? Anything new? Same old stuff?
Nah, same old for me.
Yeah.
Yeah.
All right. Well, I guess let's just jump into some topics. This first one's pretty interesting. Actually, got asked to do a media interview about this one with Ken Brew in Cincinnati. And this is basically a segment about, are you too old to have plastic surgery, or how old is too old to have plastic surgery? And
an AI image.
How'd you know? It looks good, doesn't it?
I just assume.
All right, so not to
what did you put in?
Not
like
to derail the
old
segment.
Person?
I've changed. When I want to do images now, I use Grok. Elon Musk AI. It makes way better AI images than ChatGPT does. So that's the Grok image. I thought it looked like a picture though.
Yeah, it does look like a real person.
Have they gotten the hands better?
Yes.
Yeah.
Like Grok has.
It was like hands were like
I know,
on top
like
of
6
me.
feet. They look like somebody came out of Chernobyl or something with like 6 fingers. But yeah, I've been using Grok's AI to make photos because it makes really good photos. So anyway, sorry not to derail our segment right off the bat. But yeah, so there was an article that came out this week, and I think I posted a picture of that article there. Charles, can you throw that up? Yeah. So this is from New York Post, talking about grandma makeovers, and of course, stuff hits like this, and people will ask me about it. And I guess the first thing that is to be asked is, are older people, and so older in this category would be like 60 plus. Are 60-year-olds and older
like
really
retired ages?
Yeah, tired. Oh, retired. Yeah, I thought you said tired. I'm going to definitely be tired.
That would have been rude if I said that.
Yeah, so, retired people, are they getting more plastic surgery? And, the answer to that question is yes. There's actually a lot of studies written about this and the age groups that are getting plastic surgery. And so there was a study from the American Society of Plastic Surgeons that came out in 2018, and it looked at the previous 8 years, so from 2010 to 2018, and there was almost a 30% increase. It was like 28 or 29% increase in the number of people 60 and older getting plastic surgery, which
it makes sense because people are living longer, so it's like they want to look good longer. So
totally, and so that brings up the question of why. Why is there this big boost? And you're exactly right. I mean, that's the first thing that I said is like, people are living longer and they're being more active longer.
Healthy.
Yeah, they're more healthy. And when you have these people who, they might be 60, they might be 70, and they don't feel old, and they're out there, being social and going out. And, there's so much pressure from society, especially on women, about, looking youthful. I mean, we've talked about that in the past. And so it's not surprising that they're getting plastic surgery. And then also the other thing, too, that sometimes people don't think about, and I've literally had people tell me this when they've come in for consults for plastic surgery, is like staying youthful because of work. I mean, there's definitely like this ageism thing that is out there. In fact, there was that big lawsuit against Google for exactly that, where people that are older or that are perceived as being older don't get as many promotions and have disadvantages in the workplace.
Shoot, sometimes I feel like my appearance hurts sometimes with like career stuff because people think I'm so young, so they don't take me very seriously. But I'm actually their age kind of situation.
Yeah, you do look pretty young. I had that too when I first, especially like when I was a resident doctor, because I feel like I look younger than my age, and that is especially true when I was in my 20s and I was like a resident surgeon, and people were like, "You're a doctor?" I'm like, "Yeah." I still every once in a while get people say stuff like, "Oh, you look so young."
It was pretty difficult running my store sometimes because they thought I was a college student, and then I'd be like, "No, I own this store."
This is my store. So the next question that comes up when you talk about older people getting plastic surgeries, is it safe? I think a lot of people
going under at that age.
Going under anesthesia.
Yeah.
And so, just to get right to it, yes, it actually is very safe, and there's been a lot of studies. I think I got one. If somebody wants to look at this study, throw it up there. Yeah, this is from the American Society of Plastic Surgeons as well, reporting on the cosmetic procedures, and that it was just as safe for elderly people as it was for young people.
They have to be healthy to go under just like a younger person would.
Right, so. And the only thing I would say about like safety and age is that, there is the tendency for older people to be more likely to have other health issues. And so, when I get someone your age coming into my office, we do the briefest of brief like medical history. So like, do you have any big problems going on or anything like that? Or, what's your medication list? But like older people, I get a lot more specific. Like, have you ever had any issues with your heart, with your lungs? Can you walk up a flight of stairs, so on and so forth.
Yeah.
But given all things being equal, meaning if, an older person, say 60, 70 years old or even older, if they don't have those medical conditions, then really there's no increased risk for them having surgery. And then a lot of times, at least some of the studies showed that the elderly people actually had better outcomes, that they were actually a little bit healthier than some of the younger people.
Interesting.
The only exception to that, there was one study out there that said that elderly people that get tummy tucks are a little bit more prone to complications.
I could see that. I remember when my grandma started getting older, like she would get skin infections so easily.
That's
like her
interesting.
skin
I
was
wouldn't say
just
that that's like a normal thing for elderly people.
I don't know.
Yeah,
she was
it may have
always
just been
getting
her.
skin infections.
She may have had like some underlying thing.
Yeah.
I do tons of tummy tucks. I average about one per week in my practice, and I do plenty on older people. I was trying to remember the oldest person I've ever done a tummy tuck on. I know it was in the 70s, and I think it was like older than 75. I personally haven't found them to do any worse than young people.
Yeah, the only thing I could see, just I guess maybe just from like assuming, is just like older people have like their skin's not as like
right.
It doesn't snap back as easily. It's more
and so you're 100% right. And so like I wouldn't say that would necessarily cause complications, but it can affect the quality of the outcome.
Yeah.
Because for example, like when you're doing a tummy tuck or really any surgery where you're pulling skin tight. Like if you have good quality skin, like it's gonna hold that tightness better than if your skin is like older and more stretched out. And so you'll see a lot more kind of rebound, relaxation in people with older skin.
So it like heals, like their skin heals just as good as
Typically, yeah. I mean,
Right.
I would say that,
Youthful.
yeah. I mean, like I said, as long as they don't have like underlying issues or on a bunch of medications, things like steroids that affect healing, then yeah, I mean, they do as well. And so, the next thing that kind of comes up is, so what procedures are these older people having? And there's two obvious ones that really are just kind of procedures for older people, is facelift and neck lift, which I kind of count that as one because we almost always do them together, facelift and neck lift, and then eyelids.
Oh, yeah,
because
for like the extra skin.
extra skin on the eyelids. So those are the obvious ones, but surprisingly, older people are having other surgeries as well. A lot of breast surgery. One thing that older people are, or one of the reasons that I see a fair number of older people in my practice is people who have breast implants, because breast implants don't last a lifetime, and a lot of people say if they got implants at your age, fast forward 30 years and suddenly they need to be replaced because maybe one ruptured. And so I get a steady stream, and I usually see at least a couple consults a week for people who are older who are getting implants either taken out because they don't want them anymore, or they've had them for so long that they just need to be changed or downsized or whatever. So you do see a lot of breast surgery, and then even breast reductions. A lot of women maybe wanted a breast reduction their whole life but weren't in a place where they could get it, and they get a little bit older, get a little bit more time on their hands, and then
Every time you talk about going to get your boob job redone, I'm like, oh, I dread doing that again.
Oh, really?
Yeah, I'm like, I don't
Dude.
want to do a surgery again.
Dude, exchanges are so much easier. Like, I do them literally all the time. I think I did 2 this week, and like patients sail to it because like all the hard work's done. As long as you don't have like a bad problem that we have to correct, like swapping out implants, even if you want to like change size, go up, go down, like it's a breeze.
Oh,
Really, like.
it still makes me nervous.
Oh, well, if you need it, I know a good plastic surgeon. And then, the other thing we're seeing a lot of these days are like things like tummy tuck and body contouring, which would be arm lifts and leg lifts. And you know why? Because it's so easy for people to lose weight these days.
Yeah.
They're either getting weight loss surgery
Or
they're
semaglutide.
or semaglutide. And so we are seeing a lot of people come in for body contouring, and a lot of them are older patients. So yeah, it's an interesting article. I mean, to me, it's kind of like everyone knows that, but really, in reality, people don't know, I guess, that a lot of older people. I see it in my practice every day.
I think they think more of like old Hollywood it's like that's like a old rich person thing.
Yeah,
not
it's
like
funny.
a normal.
It's funny you mentioned that, because one of the articles that was talking about this even stated that exact thing, that in the past, older people getting plastic surgery was like actors and actresses.
Yeah.
And it wasn't something that like the average older person did.
Yeah.
And that's completely out the window.
Yeah, that's what I was thinking.
Yeah.
Because I'm like, like whenever I think of like old Hollywood plastic surgery, I think of like Elizabeth Taylor.
Yeah,
and
right.
stuff.
Yeah, right.
Like getting
yeah, totally.
these crazy surgery.
Back then, like there weren't near as many older people getting plastic surgery.
Yeah.
And
Like how old is Madonna?
64, I think.
Yeah, she's retired age.
Yeah.
She's the tired age.
The tired age. Are you the tired age? But yeah, it is a common thing. Older people are getting plastic surgery, and it's kind of interesting to see some articles about it and then talk about it. So, all right, so just kind of recap this segment that we just were talking about here on Nip Talk, and it's about older people getting plastic surgery. There's some articles out saying that there are now grandma makeovers where older people like 60, 65 plus are getting tummy tucks and breast surgeries. I see this in my practice. It is happening. There's a lot of research papers out there that's showing that older people are getting more plastic surgery, a 30% increase over 8 years. The big question is it safe? And the answer is yes, it is safe. There are actually a lot of research papers out there looking at the complication rate between older people and younger people, and it's basically equivocal. Like there's no increased risk for older people. What surgeries do they have any done? Facelift, neck lifts, eyelid surgeries, but also breast surgery. Implant exchanges or implant removals are very popular. And then with all the weight loss methods out there, whether it be surgery, Ozempic, or whatever, we're seeing a lot of body contouring, tummy tucks, arm lifts, thigh lifts, things like that. So yes, older people are getting plastic surgery, and it is safe. So
I will be an old plastic surgery person then.
Are you?
I guess. I guess because I have boobs. I have babies.
Yeah, well,
So I'll
that's what
always
a lot of
have
people,
that.
don't think about that. Is like if you get breast implants, like you basically are.
You signed up for plastic surgery pretty much for like
Yeah, well, at least
until you
once
like
more.
take them out.
At least once more.
Yeah.
Because unless you're getting, I do occasionally do augmentations for the first time on women that are, older. Like, trying to think with the oldest person I've ever done a primary augmentation. Probably 60s. I'm not sure I've done 70-year-old. I know I've done body contouring stuff on them, and I know I've done exchanges, but like first time augs, probably 60s, which is kind of wild to think about, But then again, there's a lot of like 60-year-old women out there that, you probably would never guess they're that old, and they're out like going on vacation, going to the pool, like, doing all these things, and, they want to look good, and, I mean,
you gotta get those younger boys.
That's right, cougars, right?
Yeah.
All right, let's move on. Moving from plastic surgery to just kind of general medicine topic here. Sarah was surprised I didn't talk about this last week. I kind of surprised too. I just didn't think about it when I was doing segments last week. So we're going to do a segment on something that's been hitting the news for the past couple weeks, and that is the monkeypox. Mm-hmm. And it seems now whenever since 2020 and the COVID pandemic, now when you hear about these new outbreaks, people actually like take note. I mean,
I've been getting like slammed with like monkeypox articles, like, is this the new COVID?
I know, right?
And I'm like,
is it COVID again?
And I saw an Instagram post, and a doctor is pretty much like, no, this is not a situation like this. Stop. Yeah. Like, I wish media outlets would stop like putting fear. I mean,
fear sells, right? People click on that kind of stuff, and so let me ask you guys: Are you right now, before we even talk? Do you have concern about monkeypox?
No.
Charles, monkeypox. Are you nervous about this?
Oh, yes.
You are?
I don't want to get that. That is my biggest
I don't want to get it either. When's the last time that they had a vaccine for that? I mean, I know they have a vaccine, but do you have to get it? Is it part of like your vaccine record?
Who, me? Like as a doctor?
No. As just like a normal person.
Like monkeypox?
Yeah, monkeypox vaccine.
No, absolutely
yeah,
not.
I know there used to be one. I don't even think there's one. You don't have to get a smallpox vaccine
No,
anymore.
smallpox has been eradicated. Yeah.
Yeah.
These are good questions.
It's the one that puts that horrible scar on your arm, right?
Well, I think it was at the time.
Which one was that? Well, because my ex, he was in the military, and he has a scar just like my mom does when she was a little girl.
Oh, from like smallpox vaccine?
Because they still have to get that, because I guess they get deployed.
Eradicated. I don't know.
I guess they get deployed in areas that could still have it. I don't know. They have to get.
Maybe. I thought smallpox was completely eradicated. I
thought monkeypox was too.
Well,
maybe it's eradicated in the United States.
Yeah, we'll talk about that. Yeah, I don't think there's never been a case in the United States, to my knowledge, but we talk about these outbreaks, and in the past, like they weren't always they weren't always like, I guess, as worrisome as they are these days because of the pandemic we went through. I mean, we had swine flu in 2009. There was whooping cough and MERS COVID in 2012. What
makes me laugh? The swine flu.
Swine flu.
What year was that?
2009.
Dang, that was so long ago.
There was Ebola in 2014. That one actually got me nervous. Like when there was that case of Ebola in Dallas, I was like, okay, like what's my prepper plan here?
I just remember like all the time people, what year was that?
2014.
Yeah, I remember everybody was always be like, don't touch that, it could have Ebola.
Dude,
it was more of like I don't know. It was like,
let me just tell you,
you're gonna like turn into a
Ebola
zombie.
scares me. Like, I'm not a germaphobe, Like, I think I told you guys a story about during the swine flu pandemic, my wife and I went on vacation in Mexico because that's where it originated and it was so cheap to fly. Like, I'm just not like worried about stuff like that. But like, Ebola is no joke, man. I had to write a research paper in college. It was supposed to be a 30-page paper about some disease, and I picked Ebola. And like, it scared me, man. Like, I don't know if you guys have seen those movies about Ebola. Like, you start bleeding out of every hole, and like, you like barf up your guts. I mean, this is bad stuff. And like, some of them have like a mortality rate that's like insanely high, like 90% mortality rate.
Yeah, it has the same symptoms that they always give to people that turn into zombies. That's why everybody thought it was like a zombie thing. It's like when you turn into a zombie, you just like start like throwing up blood.
You're throwing up blood and stuff.
Yeah.
I remember when Ebola hit, I was like, okay, where are we gonna go if this like gets out of hand? I was like, we're getting out of this.
Underground.
Yeah, you have to go somewhere. Anyway, luckily Ebola didn't come to pass to be bad. Zika in 2016, and then of course we had COVID, and then
forgot about Zika.
Yeah, Zika, right? And then
isn't that from birds? Wasn't that from birds?
Was it mosquitoes?
Mosquitoes give you Zika.
Something that flow around.
Yeah.
Dang, I forgot
and that was pretty scary because there's so many mosquitoes here.
I know, right? I feel like we're in the war zone. But anyway, we always heard about those, but now after 2020, I think people really are more, I don't want to say scared, but more.
They have trauma.
Yeah, right. We're traumatized from like what happened, and so, when these things pop up, I think it's important to be realistic about it and talk about them. So, monkeypox was just recently declared a health emergency of international concern by the World Health Organization. Mm-hmm. Now, this is not the first time that happened. There was an outbreak in 2022. And the World Health Organization said the same exact thing, like this is a big deal, but then it died out pretty quickly and like everyone forgot about it. Well, there's currently a new outbreak going on in Africa and is now spread to Europe. Sweden, I think, saw the first case.
I thought there was one in California now, isn't there?
That might be brand new. As of this week, I hadn't seen that there was one in the United States. Travis, do you know? Is there monkeypox in the United States yet?
I am researching it now. I haven't heard that one.
He's like, I gotta know.
What does Google say?
I swear that I saw a post about it being there was a case in California.
The only case that I saw outside of Africa so far was Europe.
Yeah.
But
I could be,
I mean, regardless, I think, when you have these potential outbreaks, it's important to know about it, right? The more you know, like hopefully the less you can be worried about something.
I think people just need to know the actual number facts, like what is considered an outbreak, what's considered a pandemic, an endemic, or those things.
That's good. Do you know those specific numbers?
No, but I know that there are numbers that apply to that. Because I did take epidemiology.
Did you?
Yes.
I don't know them off the top of my head either.
That was like 12 years ago.
It's been a while. You're digging deep. So I just want to kind of answer these questions. What is monkeypox, and is it a threat to America, or is it a threat to the world? So monkeypox actually was renamed in 2022 to Mpox, but apparently it goes by both names. In fact, when you do Google search,
is that its rap name, Mpox? Like, why does it matter if
it's something about like they don't want to stigmatize a region or something. Like they're very careful about like naming things these days. And so, but it kind of goes by both. So this virus is in the same family as smallpox, which that's kind of scary, right? I mean, smallpox killed
Is it similar to, is chickenpox a part of that same kind of virus?
I believe so.
Because they're both considered herpes viruses, right?
No, I think you're thinking of herpes zoster. Is that different?
Is that chickenpox?
No,
because herpes.
That's varicella.
Because chickenpox is considered a herpes virus.
It's different than that. It's like a optopox or orthopox or something. Is like the family, and I think that's different than the varicella, which is chickenpox. Don't quote me on that, but I'm pretty sure that's right. But it is in the same family as smallpox, which obviously is concerning. Smallpox killed 500 million people, during its few hundred year run, including like kings and heads of state. Fortunately, monkeypox or Mpox is, although the symptoms are very similar to smallpox, it's much, much less dangerous. Yeah. So that's the first thing to kind of know.
So you're not going to people probably can die, but it's more treatable.
Correct.
In the right environments.
Yes. Okay. Yeah. After someone's infected, the symptoms at first are kind of constitutional, meaning that you don't get like the blisters right away. Includes things like fever, headache, muscle pain, fatigue, and swollen lymph nodes. And then that's followed by this rash of pustules, which can be anywhere from a few to thousands. There's a picture, Charles, throw that one up there if you would. Of the monkeypox. Yep, that looks bad. I agree, Travis. I do not want that anywhere on my body.
Exactly why I don't want
Especially because it's prone to affect the face, mouth, groin, genitals, and then the hands and feet. So that's pretty bad. And those little things start out, they have like a pattern to them. They start out here, go to that next picture, I'll just kind of show the pattern of this. Yeah, they start out as like little macules, which are basically just red dots on the skin, then they raise up into papules, and then become vesicles, which are like fluid filled, and then they become pustules, which are pus filled, and then they eventually rupture and you're left with like all these like scabs, which can be, potentially disfiguring, if they're significant enough. Yeah, I know. You don't want this. So this disease is spread by contact. So that could be like physical contact, like shake hands, or sexual contact is the other way.
Yeah, if you said it likes to be around the genitals.
Yep, absolutely.
That's a rough situation.
You do not want that. You thought herpes was bad, man. You had monkeypox on your genitals. That's bad news, right?
God.
It can also have some transmission via airborne particles, although that's not like the most common way that it's transmitted. But the interesting thing about this, going back to the direct contact, like for example, if I have Mpox and I'm wearing clothes, and then you were to put on my clothes, you can get it from clothes or bedding, which means that like it is possible to transmit it via, they call that fomites. So like fomite is just like an object. You remember that from epidemiology, fomite?
No.
Oh, okay.
But I understand.
Okay, gotcha.
I understand from insinuation.
It also can be spread from animals to humans and vice versa. So like if your dog gets monkeypox somehow and comes up and jumps in bed with you, like
how sad.
I know, right? You have to put old
give
Yeller down.
that to my dog, man.
You feel bad if you gave your dog monkeypox?
Yeah, that'd be horrible.
That would be bad. So severity, right? So the severity does vary widely. Most of the time, this resolves on its own without making people really sick. However, there are certain people that are more at risk to get a severe form of this. So that'd be like very young people, very elderly people, people who are immunocompromised. And the mortality rate, this is like a little bit unsettling. It says it's from 0.1% to 10%. But it depends very, very heavily on the patient, like meaning, are they immunocompromised or like very frail, and then the level of care that they can receive. But interestingly enough, like there's not, it's kind of like, other viruses where there's not like it's not like you take an antibiotic and it goes away. Mostly it's supportive therapy, like you take, fever medication, pain medication. There are antivirals out there that can shorten the duration of it. And then caring for the pustules because they can create wounds and whatnot.
Yeah,
so it's
I wonder if it like doesn't spread as much as if like you obviously you don't share your clothes, but if you're wearing like wrapping stuff
like
around.
a leper wrap, like the lepers
yeah.
wore.
So it's like people aren't touching you or like you just seclude yourself.
Well, and part of the problem is that if I remember correctly, you can transmit it prior to getting those like the rashes on you and stuff. So
just like any other virus,
just like
I
any
guess.
virus, like you can spread it before it like really becomes apparent. And there is a vaccine for this. It's related to the smallpox vaccine, but there's not a lot of it out there. Like it's not like they have stores of this stuff. So it comes back to the question of is smallpox like a big threat? I mean, probably not. Like most of the experts are saying that this is not like a big risk to become anything significant. And if you do get it in a developed country, like your risk of like having some severe case where you die from it is exceedingly rare.
Yeah.
So it would be mostly like really kind of already very sick people that would be at risk. So it's something that most of the experts are saying something to keep on the radar. It's like, okay, let's just watch the cases, but do we need to start prepping for the next big pandemic? Yeah, probably not. So
they better not.
Yeah, I'm done with pandemic. I don't want to see another pandemic in my lifetime.
I'm like, how some people are like more like, I guess with this situation, they're more like hyper vigilant. Like they're like really like sketched out by anything, kind of like they're super scared about monkeypox for no real reason. But to me, I'm kind of like numb to it. I'm like, ugh, whatever.
I know, right? So you get burnout.
Yeah.
Yeah.
So I think there's like two sides of that.
So just to summarize this segment, so today we were talking about monkeypox. It's been all over the news because the World Health Organization just stated that monkeypox is a international concern at this time due to an outbreak in Africa that now has spread to Europe. So what is monkeypox? It's actually a virus in the same family as smallpox, which is a little concerning because smallpox killed about 500 million people in the 1700s. However, monkeypox is not nearly as severe as smallpox, thankfully, although the symptoms are kind of similar. People start out with fever, headache, joint pain, fatigue, swollen lymph nodes, and then go on to develop these pustules on their body, which like to be on the hands, the feet, the genitals, the face, the eyes. Fortunately, most people resolve without a very severe case of this. The mortality rate is overall very low, especially in developed countries. And most experts are saying that although this is something we need to keep on our radar, it's not something that seems to be a big threat to us in the United States right now. So, monkeypox.
Yeah, protect those genitals.
Absolutely, man, I do not want to get those things on my genitals. That would be bad. That would be so bad.
No pustules.
Oh man, that would be rough. That would be real rough. All right, I know you guys. I know you love a good drama story here. Not to make light of this, but it's always interesting to hear these crazy outcomes in plastic surgery. And this one was pretty wild, and it came from
Lowrider.
Absolutely right. So this is a segment about a lady who says she had a nightmare facelift that left her blind in one eye. As we stated, this can.
She looks pretty scary.
I know that patch. I would do like if I had to wear a patch, I'd get like one of the pirate ones, like the black one,
Yeah,
like
that one looks really.
I don't like that one.
Sketchy, handmade.
Yeah.
She needs to elevate.
This actually happened back in February. A patient went, and it didn't name the surgeon, which was really weird. Went to a unnamed plastic surgeon or cosmetic surgeon. Not sure if it was really a plastic surgeon. I think it probably was not, but we'll get to that. And had a facelift. Mm-hmm. And this is where the story gets confusing. The details were not great, but the lady basically says she woke up and couldn't see out of one eye. And I was like, that's really odd. Like, what would cause blindness in a facelift? Now, I know you guys probably don't have the kind of background to know that a facelift really doesn't mess with the eyes at all. In fact,
I would assume it wouldn't.
Yeah, I mean,
unless you do like the eyelid surgery.
Right,
with
in
it.
which they specifically said that she did not have eyelid surgery, because a lot of times people will do a facelift and eyelid surgery at the same time, as we talked about in the
doesn't facelift go right
here?
Yeah,
so the incisions are around the ear for facelift, and you do dissect towards the eye, but at least I and most people leave about a 2 centimeter gap from the corner of the eye to the furthest part that you would do dissection. So you're like really, really far away from the eye. Mm-hmm. So I was like, okay, how did this happen? And I was like, well, sometimes surgeons will do fat grafting, when they do facelift, and like, is it possible that some fat cells got into the bloodstream and got to the blood supply to the eye? I mean, that'd be very unlikely because that comes from the carotid artery, which is, in the neck, and it does go up here, but it kind of goes into the skull. And I was like, I can't really imagine how that happens. So I'm reading this, and I'm just like, well, how did this go down? Well, it turns out that the issue, at least from what I gather from this lady's story, is that she had extreme swelling of her eye, which would be weird for facelift. I mean, I've done some facelifts where people really swelled up, but generally it's the face, not the eyes.
Yeah.
And the issue is that she couldn't close her eye, and her eye dried out, and she got a really bad corneal ulceration, which absolutely can, blind you, at least temporarily.
Oh, so she didn't like wake up from surgery blind. She just woke up from surgery with her eye swollen and she couldn't shut it correctly?
Yeah, I think that's probably what went down, is she had some really severe swelling reaction. Her eyelid swelled shut, and then when the swelling started to go down, it didn't close properly, and then it dried out, and she got this corneal ulceration. I'm guessing. Like I said, the details are a little sketchy.
Just like her eye patch.
Exactly. But now she's still months out, and she says she can't really see out of her eye. I guess she probably has got some scar on her cornea, and it's affecting her vision. And this is where the story, gets kind of really sketchy. So she was considered suing her surgeon, and her surgeon doesn't carry malpractice insurance. And we just talked about that, what was it, like a month or so ago, about, I didn't know that this was a thing, to be honest. I just blew my mind to hear that there are, I'm going to put in quotes, plastic surgeons that don't have malpractice insurance. And, with all these stories, we talk about them not to sensationalize it, but like, what is there to learn from this? Like, as you as a patient, what can you learn from this lady's experience to potentially have a bad outcome? And I think there are a couple of things here, and these are things that we have talked about at times in the past. Any surgeon who doesn't have malpractice insurance is an absolute no-go. I mean,
up to no good.
Honestly, like, there is no excuse whatsoever for a plastic surgeon not to carry malpractice insurance, and it is a huge, huge red flag, because it means one of two things. It means that, one, they're a plastic surgeon who's had a lot of bad outcomes and has been sued before, and just like car insurance, because they have a lot of claims, the cost goes way up and they can't afford it.
Right.
So that's one possibility. Good.
So like, for malpractice, like as a surgeon, wouldn't you have to be considered, like, you know how some of these people are like general doctors and they're not even real surgeons, so it's like they can't even get malpractice surgery insurance.
That would be the other reason. Yeah. The other reason I think that people might not carry malpractice insurance is they can't be insured because they're not actually a plastic surgeon.
They are. Yeah, so maybe that guy that did that wasn't even a real surgeon because we can't even find him.
That's exactly right. That's what I was thinking. Now, I don't know that. These are just like we do know he didn't have malpractice insurance.
We're just going to assume what we assume of Florida.
Right. But yeah, it's a huge warning flag if your surgeon doesn't have malpractice. And it's a shame that you even have to ask these questions. There is one quick way to know if they have malpractice insurance is, are they doing the surgery in a accredited surgery center? Yeah. Because I cannot go and operate a surgery center, or a hospital for that matter, if I don't prove that I have malpractice insurance, which means that this was done, in an office. This was an office-based surgery. I've talked about office-based surgery before. I'm personally against it, and I'm going to say that I'm sure, and I know that there are some very good, skilled, careful plastic surgeons out there who operate out of their own offices. However, that being said, when people are operated on in an office, there is not that oversight that is present in a surgery center. So for example, like you can operate without malpractice insurance in your office. Yeah. You can do procedures that you're not trained to do in your office.
There's a bunch of gray areas.
Yeah, it just opens up the potential for some
like pretty much unnecessary risks, in my opinion.
Yeah, I mean, like I said, I know plastic surgeons out there that have their own offices that are great surgeons, and they're very safe and they're very good. But on the other hand, you can't get away with a lot of bad things in a surgery center that you could get away with in an office. And as a patient, it's hard to know who's who. Yeah. And so, I'm not saying that it's a bad idea to get plastic surgery in somebody's office OR. However, you need to make sure that they're legit. Yeah. Right? That they are a board certified plastic surgeon, that they are carrying malpractice insurance. Of course, then we always talk about, we've heard those stories about, remember the girl that had cardiac arrest during the surgery and they refused to call 911? There's been a couple of those actually. Like you can get away with that in an office OR, you cannot get away with that in a surgery center. So definitely. I don't know. I mean, it's, like I said, I have friends who have office ORs, and I'm not like, trying to poop on them or anything, but but there is a extra level of risk involved with doing office surgery versus surgery center surgery. Yeah. Yeah. And so I think those are things to learn. The more education people have, and the more knowledge they have, I think the more likely they are to avoid some bad outcome like this. Yeah. Because there's definitely some sketchiness going on in this story. I mean, the fact that why did her eye swell like that? That's not something that should happen with surgery like this. She got some
pink eye and
she had MonkeyPox in her eye.
Yeah, she got some pustules in there.
I don't think so. But hopefully she'll get her vision back. I think it's something that can be fixed. In fact, the lady in the article was talking about how she's been talking to a
that picture looks old though.
It's just not a great.
It looks like it's from like the 80s.
Like from the 80s. Throw it back up there, Travis. Does it look like it's from the 80s?
It looks like an unsolved mystery picture.
Yeah. Like.
Oh my God, you guys are killing me. Yeah, I agree. I think part of the problem is like I pulled that image off of like a news article, and like it's just not a high quality image. I don't know why she's wearing that. Maybe that's like a dressing that you're doing. But she does have like her makeup's like on point and stuff. Like.
Absolutely.
She just wants, I don't know. It just makes me laugh. She looks like she'd be the type of woman, like how her makeup's done, like she'd have like a pretty eye patch.
Like it all blinged out.
Like with it like maybe monogrammed or something,
Monogrammed
Like that's patch. The way she did her makeup makes it seem like that. But no, she has like this eye patch that looks like she like went to CVS and just like put tape all over.
I think if
her
I like
face.
lost an eye, because now you can get like glass eyes, like say your eye goes out and like it, I don't know, withers or something. Like I think I'd probably just get a patch. I think that'd be kind of cool.
Yeah, and just have that
just rock
persona.
The patch. Like, isn't there like a famous politician with a patch? Like he's like I think he's a Republican guy, right?
Yes, I know who you're talking about.
Crenshaw or something?
Yes.
Is that his name?
Yes.
I don't know where I came up with that.
I follow him on Instagram.
Oh, really?
I think.
Yeah. Isn't he from Texas?
I don't know.
I don't know.
I don't know if I don't know if, I think I do, but I don't know if I muted him. Sometimes when they get too obnoxious about stuff, I just tend to mute them.
I'm about ready for the election to be over, man. It's just like constantly just force fed to you about. It's just, I'm ready for it to be done. However it goes, and just be glad it's over. Yeah.
Me too.
All right. I think that's all the time we have for today. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. Hit the notification button too, so you know when the next videos come out on Nip Talk. Thanks.
Bye.
Bye.